Dr. Bains, thank you for coming by.
Of course.
Hey, for everybody watching, Dr. Bains is he's a doctor of physical therapy, and we wanted to bring him on board to really provide an insight of what that journey is like, some of the basic problems you see today in terms of injury. And I mean, you don't have to be an athlete to be injured. You could do it in many different ways. So we're going to go ahead and explore all that stuff. And Dr. Bains, we're just going to go ahead and start with, what drew your attention into becoming the doctor of physical therapy?
All right. So my journey is kind of a little, not too crazy. So I'm local. So local raised, Fresno, California. I grew up in the country, kind of out on a ranch, on an almond orchard and all that stuff. And then I transferred schools and I went to Clovis West. So I switched midway through, went to Clovis West, and then kind of got into sports because they realized like, hey, this dude's like in 7th grade, he's 200 pounds. He should probably do some sports.
Jesus.
So yeah, it was. So I started doing sports, kind of got into that, and then after we got into high school and started doing like 3 sports. So I started with like track and field was my first one that I did, and then I picked up wrestling and football. So I ended up doing like 4 years of 3 sports. So it was like busy. I was just kind of used to the busy. And then in that whole period of kind of doing sports, I ended up becoming pretty good at them because I didn't really know too much because I grew up in the country where we played like flag football and we didn't have any competitive stuff.
Right.
And I came to Clovis Unified and it was like, oh shit, like this is like the real deal, like Texas football, like it was wild. So we started doing all that stuff, and then by my junior year, I got good enough to get a bunch of offers for scholarships. So I had a few offers for football, a few offers for wrestling, and a few offers for track, and I ended up taking the offer for track. So I chose to do shot put and discus, and then I decided to leave Fresno, and I went to Long Beach State. So I ended up doing 4 years there with track and field. So it was just awesome. It was nice because I got to have the fun of the athlete and have all the priority stuff, but also was able to choose what I wanted to do as far as like my major goes because it was not as rigorous as football, which is kind of, and it's also like being Indian, there wasn't too many Punjabi like athletes, which is very different. There's not many. Like you'll get like a handful because I went to school and there was, I want to say in my whole graduating class, there was probably like 6 of us. And I was the only one, maybe 1 or 2 of us did sports. So it was very, very different. So I ended up transferring over there, and in Long Beach, there's no Indian people, really. None that are like no Punjabi people. So it was very different because I went there, I was like, oh, like there's no one like that looks like me. So it was very, very different. But it was a nice change of pace, and also being out of like on my own. Because it's very, I don't know if you know, but like being an Indian male and being raised, I never washed a dish. I never did a single load of laundry growing up until I went to college, and I was like, oh shit, like this is what it's all about. Like I have to do all this and do school. So it was very different. So after kind of college, I ended up, I kind of went the traditional route because there's a huge push in our culture to go into the medical field or go into some mathematics or something where it's like
100%.
high income earning type thing. Or so I ended up going kind of like pre-med, which is good. And track kind of helped me with that, where it's like not as rigorous as football, where they straight up, when I was getting football offers, like you can't go that route. Like you need to do
There's a certain level of commitment you need.
They're like, you're not going to have time for that with all the film and everything we have to do. So it was nice because I had more freedom. So I did that, and then after I graduated, I went and I worked as so after I graduated, there was this little period where I kind of chilled and was like thinking about what I wanted to do and kind of shadowing. So I was kind of in the boat that some of these viewers might be in. It's like, okay, I graduated, I have my bachelor's, now what do I do? Like, do I do this whole MCAT route and do all this stuff, or like, is it really worth it? So that was kind of the little dilemma I was in.
Okay. Well, like you were talking about the whole push for the medical field in our Punjabi culture. And again, I feel like I have to stated in every podcast, there's absolutely nothing wrong with our parents wanting us to be
No, not at all.
in one of the best professions.
Yeah,
Nothing wrong at all. And it's, they worked so hard to be here, and they only want us to be on ourselves. But in a sense, we also have to kind of show them that, it's not the only route, right? Like, in your case, you took full advantage of it. You were able to go ahead and succeed in that. And I'm just trying to say not everyone is able to do that.
No. And you don't have to. That's the big thing. So the thing with me was, so I was able to do that. And then once I got there at the end, I'm like, do I even want to do this? And it's like, when you're there, you're like, oh, like, so I've shadowed doctors, and it's like the quality of life balance, like the work-life balance, is very off. So I don't know if you know, but like physicians and doctors have one of the like worst ratings for like self-care. So their own, they can care for others, but like doing it for themselves is rated very poorly.
I when I was actually at Kaiser for a bit, I used to volunteer there while I was an undergrad, and the director of oncology, she was the main doctor there, and she told me all this stuff beforehand, because I was like, hey, I'm trying to explore the medical field. This is kind of where I've had my mind, because it was the only thing I knew, right? And she's like, look, if you want this for the money, it's not worth it. You will get your dollar, but you will not have a life with that dollar. And that kind of hit me, because I am someone that values not necessarily like full freedom or whatever, that I don't like working, but I prefer that balance that you're talking about that you can't have as a physician. And so that kind of drove me away, because I don't want to wake up the next day and be like, oh, man, I have to go back to work. And I never, because she told me, she's like, listen, as a doctor, I'm off at 7 p.m., but I get a call at 1 a.m. from my nurses. I get a call at 3 a.m. in my nurse. And guess what? I'm still liable, and I still have to pick up that call because my patient needs me.
So my big thing was, so I had that, and I was like, okay, after shadowing, and like, okay, like I'm not going to see 35 people a day. That's like busy. And it's like, there was a lot of factors in it. So the reason I brought up all the sports I did, so I did track and field, I did all these sports, so then I would spend a lot of time in the training room. So I would be around athletic trainers. They would do like, obviously all the rehab type stuff. They would ice and this and all the different modalities you use. And so I got intrigued. I was like, oh, like that looks really fun. But it also doesn't look fun, because I don't know if I want to travel with teams and do all that stuff. So I was like, where can I find a middle ground? And that's kind of when I found physical therapy, which is kind of a middle ground between like, yes, I'm working with the athletic population, but I'm also implementing a medical portion to it. So that's when I looked into PT school and all that stuff. So after I graduated, I kind of took a year to work as a PT aide, so what they call it. So there's like 3 levels. So there's a PT, which is kind of the doctor of physical therapy, which they now require you to have a doctorate. So it's a requirement to be licensed. And in the past, you can get grandfathered in if you have like a master's and stuff like that. But coming in now for new grads has to be a doctorate. Right under that, it's something called PTA, which is a physical therapy assistant. So it's essentially like a PT, but the program is less, it's not as long.
I got you. It's like a physician and physician
like
assistant.
A PA, So it's like the PA, so they actually can't do the evaluation part, but they can do the treatments.
Gotcha.
And then under that is a PT aide, which is like, there's no real degree required, and it's almost like you're helping out with things to get your hours for school.
Right.
So that was a requirement from most schools. Most schools require you either volunteer or get X amount of hours to apply. So I worked as a PT aide for, I would say like 8-9 months or something like that. And then I was working there, and then I did my application. Once I found out I got in, I quit the job, and I was like, all right, let me relax before school starts. It's definitely, the PT aide is really nice to go into. Like, it's really nice to see how the clinic flows and do all that stuff. And there's lots of opportunities to be a PT aide around here. Call most clinics, and they'll kind of let you kind of apply and do that stuff.
Right, and it kind of, I would assume it gives you the insight of what you're going to be doing for the rest of your life. You're right. Like you're going to be working with other physicians. Mm-hmm. Well, okay. And, in your opinion, or just provide us some insight for someone that wants to become what you are, a physical therapist.
Yeah. So essentially what you have to do, the requirements. So you have to have a bachelor's of some sort. So it doesn't really matter what you get your bachelor's in. So you can go and get your bachelor's in art. But the requirements for applying to the program is you have to have these classes. So you could essentially be a art major, but you took this biology, chemistry, physics, all this stuff, and you can still apply. So there's X amount of classes that you need. There's X amount of hours, depending on the school, that you have to volunteer or work. And then you have to take a test called your GRE, which is an awful test. It is terrible.
Right.
It's essentially like taking your SATs, where it's like you walk out of there like, I don't even know what I did. Like, did I even get these right? And then you end up getting this. It's not a crazy hard test, but it's like studying, and you just go out of there feeling like you failed.
Yeah.
So it's kind of like your SATs. Like, oh, like I didn't like ace it, but I'm like, I didn't do bad. So just figuring that out. And once you get all of those things together, so essentially your degree, the required classes that you need, and then you have to take that test and then have X amount of volunteer hours. Some schools have like 40. Some schools have 200. So it just depends on the school. And then you fill out the application. But the percentage is getting very, very difficult. So getting into PT school is very challenging now.
I think that's across the board of any med school.
Anything,
nowadays.
yeah. So so from what I heard last time, so I went to school down in San Diego, so I didn't go to school here. But from what I heard at Fresno State, because I just had 2 of my PT aides just got into PT school, and I wrote the letters of rec for them. So it was I want to say there was like 2,000 applicants, and out of those 2,000, I want to say like 100 get chosen for interviews. Mm-hmm. And out of that 100, they take like 30 something.
Yeah. Before we go any forward, what is because you've been through it all, and what is your opinion? Because I'll share mine a little bit, and I think it's kind of conflicting in terms of the U.S. is always saying, hey, how come we don't have any homegrown doctors? We don't have any physicians. We don't have physical therapists that do their stuff here. Like we always have to import people and all that. But then at the same time, it's like, if you look on the other side, it's your school prereqs that are making that the case, because nobody, for example, when I was I graduated high school, and I was just like, okay, I'm just going to be a doctor. Mm-hmm. And then, but I had no roadmap, right?
Yeah.
And so in my head, it was like, okay, I have to be a science major. I have to be a bio major or a chemistry major. Mm-hmm. And that kind of, not necessarily because I hated it or anything, I just got overloaded in terms of there was, being a bio major, you're taking nothing but so many bio classes, so many chemistry classes. And I didn't know that you could be a different major, just complete the prereqs like you were saying. And then, with the U.S. medical schools, and I'm sure it's the same thing with the PT schools, they make it so hard to where it's like, okay, you have the hours, but you don't have the GPA, because let's say you're doing a prereq and you're great at doing your prereqs, right? And you have an A in every class you need to get in, but then you have that one GE class that ended up giving you a C because you're not good at that subject. And all of a sudden now you go from the top of the list to maybe in the middle or out of it.
So I've heard that happen to a lot of people where they're having to retake like a history class and stuff like that. So it gets complicated. I don't know. So as far as like US versus other countries, as far as I know, for physical therapy, it's different than for like physicians. So physicians in other countries, it's very different, because right now I know physicians are having a tough time getting residencies in America because they're not taking them. They're not accepting them. So I have a family friend cousin who had that same thing. Went to India, finished med school, came here, wasn't able to get residency. So had to go a different route. So it's like you're a doctor, but you're not here.
Well, you've been a teacher as well, teaching classes for that. Do you see the stuff you were teaching, not necessarily you being the professor, but the curriculum that the school gives, hey, you got to teach this stuff to the kids. I mean, is that relevant to what you did? Did they give you a curriculum?
Yeah. So that's a whole different thing. So that was like after grad school. So once I went to grad school and I completed it, which I'll kind of go into detail about like what the difference is between like undergrad and grad school. Like it's very different because undergrad, like I went there and it was like, okay, like I had my fun. I did sports. I was hanging out. I thankfully was smart enough to get good grades and then was able to kind of get into grad school versus I know a lot of people that's like, oh, damn, like the first year they just mess up and they can never catch up, which is challenging because it's like, yeah, that sometimes you want to just kind of, it's a big shock for some people. But the difference is like in regular undergrad, it's like people aren't interested in some of the stuff. So you're there to find your interest, but you almost are forced to take certain classes, which you aren't interested in, but it's like they're called like your capstone classes and all that stuff you have to take, which is like, I don't know. In the back of my mind, I felt it a test. Like when I was in undergrad, it was like, okay, like we're taking these chemistry classes, physics classes. I'm like, all right, am I really gonna use this stuff in grad school, or are they like testing me to make sure I'm like dedicated enough to take this so I could survive grad school? So I was like, okay, maybe they're just testing us by making us take all these classes. So I don't know what the rhyme or reason, but the weird thing is, like, you do use chemistry. You do use physics. You do use a lot of that stuff. And I didn't realize it until I was in grad school because before I was, like, young, naive. I'm like, oh, this is dumb. Like, why am I learning about molecules and this and that? Then you go into grad school, you're like, oh, thank God I learned about this. I'm like, oh.
Yeah, when it comes to the major classes, I fully understand. I'm talking about, like, having to take anthropology, having to take sociology. And again, I think that's more to kind of raise your awareness of your surroundings, which is cool.
Yeah.
I just think it's, in my opinion, kind of ridiculous that all these schools are going down to the fact that they're counting on you. In my opinion, you should be able to, as a school, select the top of the line. And I understand, like, we could keep on going this rabbit hole.
Yeah.
The whole reason they're doing it is because there's too many applicants and they need some type of tool to knock it down.
To weed them. You have to weed them down. Otherwise, you're going to have people practicing that are not qualified to practice, or they're going to have a lot more dropout. Their rates. That's what they look at. The grad schools, they look at their goal, their measure is not even graduation. It's their measure they look at is what percentage of that class pass boards.
Gotcha.
So that's what they advertise. They say, oh, our graduating class, like we have an average pass rate of like 98%. So that's like one or two people might have not passed it. So that's the big thing. You're looking for people that are going to pass boards. Not essentially, which is tricky because it's like not essentially be a good therapist.
Right.
So that's where it gets a little tricky because being a good therapist it's multifactorial. It's not just you're good at school. If I can't communicate to my patient or have social skills, I'm not going to, I might have to go into research so that's the nice thing. So the nice thing about therapy, as far as physical therapy goes, it's you don't have to just be a therapist.
Right.
Same thing with most of the medical field. Some of the medical field, you can go into different routes. So when I graduated, I kind of taught a little bit, which was teaching PT school and all that stuff. So it's nice to have that route. And then you can go a different route and go work as a lab person and go do like different, when you hear about like, oh, now they're doing this like test and they're doing all these different like random meta-analysis and doing all these things, you can be a person that does all of that. Like they're looking up different articles and research articles and comparing for optimal muscle strength or optimal exercise for hamstring firing and tons of different things. So you can go that route. And then you can also go the route of kind of working in the hospital. Like there's lots of different avenues. And that's kind of what really led me towards PT. Because I was like, all right, like I want to work with athletes. Like I'm like, oh, cool. Athletes are cool. And that was what majority of, I would say a lot of people going into PT school, like, oh, I want to work with athletes. When you're out of PT school, you're like, oh, I don't want to work with athletes. Like, it's like, I work with a lot of athletes. And I do a few different things here. And I also work with athletes privately, which is good. And I'll talk about that later. But athletes are very complex because there's some stubborn stuff going on. There's lack of knowledge, and then there's also conflicting knowledge with coaches telling them something their weightlifting coach telling them something, a whole bunch of, and then all social media telling them something else, and just trying to get that message across.
So then what are the most common, like I'm talking about the ones you see so often. What type of injury do you think is most common among athletes? And then also for the people that think it's only for athletes, like non-athletes.
Yeah. So I work at a few different places. So I work at Clovis Community Hospital. So I've done the inpatient. So I work in the hospital, like where all the wild stuff happens. So like the strokes, all this stuff. So I've worked there and I see that stuff. I work in the outpatient center, which is a lot of post-op. So a lot of post-operative rehab, but then also a lot of just injuries per se. But I also do private PT, which is, so I do private. The reason I do private PT is because in those clinics, there's a tricky thing kind of happening right now with Medicare. So I don't know if you've heard about this there's a big deal and it's huge. It's Medicare is now decreasing their reimbursement rates for physical therapy and other services like chiropractors, all this stuff. So essentially, we're essentially doing our same amount of work, but we're getting reimbursed less, which means that the company you work for, so if you work for a company or a corporation or a hospital, something, you're going to now have to see more patients to cover that gap. So they reduced it last year, and I think they're going to reduce it again.
Is there a reason behind that? Is this more of a political thing? Is it more of just something that's been in the works for, regardless of who's in the office?
Honestly, I don't know. All I know is the people that are supposed to fight against it, like it's called the board of like the APTA, isn't really doing their job to kind of do that. So I don't really know if it's because there's a lot of people that lobby, like you lobby for things and all that stuff. So I just know that the Physical Therapy Association doesn't really have a strong lobby. So it gets a little tricky. So I don't really know what the deal is. All I know is that once that passes, we can't really do anything about it. So it's like all of a sudden now you're getting paid. It's essentially that, and it gets really tricky because people used to manipulate the system a lot back in the days, back when physical therapy, early on, there was a lot of kind of clinics out there just saying, oh, this person, they were just billing per visit versus billing for time they were there. And it gets really tricky, and I can talk about it for hours. So it's like we don't want to go down that rabbit hole because it gets a whole other conversation into like the legality of it, like what they were doing. Was it wrong? Was it right? So, but as far as like that goes, so working in those clinics. So the reason I mentioned that was working in those clinics, you are going to have to see people for more people per day, which means it has less one-on-one time.
Gotcha.
So yes, you still get a good amount of time during your evaluations, but in those clinics, the PT aides and the PTAs start helping out and start doing some of this stuff. When in certain cases, like with younger athletes, where I want everything a very specific way, and if it's not that way, that person could be doing something wrong and kind of making things worse. That's why I kind of leaned over to this private sector where it's like, I want to be able to spend an hour and a half with you, educate you, make sure you know everything, and kind of just pay for it in cash. Like it's,
I mean, as a patient, like, we all have doctors and everything, and I've worked with you in the past as well. Yeah, that does make a big difference because anytime I have a question, you're right there versus having to go back and forth with an email list because you do have that time.
Yeah.
You make that time and then you're able to kind of, the social interaction, I feel like, especially during the pandemic, you realized how important it is. And it's just as important now, times 10, I feel like with a professional that you're trying to literally work on your body with, work on your health with.
Yeah.
So again, like what injury do you see your most common injury?
So most common injury is going to be low back pain. So general low back pain. So, and what's tricky is it is an injury, but it is also very common to experience. I want to say like 99% of people experience low back pain at some point in their life. So it's like, it is a typical injury we see a lot of people for. The tricky part is that there is this big medical push for low back pain. I have low back pain. They end up going, so my big thing is whoever you see, so wherever you go, whoever you see is going to have their opinion on your care. So if you were to go, say you have low back pain, and you were to go, and for some reason your primary doctor is a surgeon, and they're a low back surgeon, and you go and do it,
surgery.
they're probably going to recommend surgery.
Yeah.
If you go to a chiropractor, they're probably going to recommend they adjust or manipulate. If you go see, whoever you go see is going to recommend doing what they do. So that's kind of where I like the physical therapy realm, because essentially our recommendations are to move and exercise. Like make your body better by getting things stronger and more stable, and kind of figuring out what's going on with you.
Right, because I never truly, I mean, is that more of a relevant or new science, or is this something that's always been there, just been in the shadows, where it's like, if I got injured before, the whole treatment would be like, you go to the doctor and they're like, hey, just don't do that, or like, don't exercise, don't do this, just stay in your bed, take your pills until it's healed, and then go out there. And then when you come across, actually, I don't mean that not all physicians know what they're talking about, but you come across an actual physical therapist. For example, when I came across you and I'm like, hey man, like I kind of don't want to stop lifting. Remember, mine was a knee pain, right? And the first thing you said to me was like, oh no, you shouldn't stop lifting. And I'm like, okay, I'm liking this already, but it wasn't just because of that, but it was also because, when I kept on doing it, it's something I enjoy, right? Mm-hmm. And once you're told that you could, you were the kind of the one to open my eyes that you could heal through exercise. It's just a matter of taking extra care, whether it's with warm-ups, like the types of warm-ups you have.
Modifying things,
just refining little things at a time until it does heal. And mine did work. Yeah. I've had previous injuries before where I didn't see a PT for my lower back pain. Yeah. And at that point, I was instructed to just sit down, which I did for about 5-6 weeks. And it didn't necessarily heal me because of the rest. I feel like it's because I still continued to stretch. I just didn't lift. Mm-hmm. And still kept on doing some warm-up exercises with it. And then, but this time when I had your recommendation of what to do and continue to lift, I had lower back pain. I want to say just like a month ago, I had back spasms. Yep. I saw you for that, and I continued to do it. And now I'm 100% okay.
Yeah. So it gets tricky. So like I was saying, each profession is going to have their own input. Even certain therapists are going to have their own input on things. Like every person has their own way of treating. So it's very different. But as being a physical therapist, yes, you're like I always tell my patients, like you should, like my exercises I give you are a prescription. Treat them like a prescription, because treat them like it was a medication that a doctor gave you, because that is what I'm giving you. I'm giving you an exercise prescription, and that's kind of what the goal is, to get you better. We just have a different form of medication, which is movement, and very specific controlled movements that are ultimately, and again, it's like you need to modify. If I notice something isn't changing, I'm not going to make you keep doing it. Like I'm obviously going to change it if it's not working out. And now that we are a doctorate profession, we know the red flags. We know when to send you to a doctor. Like if you had something very significant, and I was like, okay, damn, like that's pretty serious. Like you're like, if for example, if you had low back pain, and I was like, okay, like yeah, let's work on this. And then all of a sudden you tell me, yeah, when I take a step, my leg buckles and I fall every step I take. I'm like, okay, you should probably go to a doctor. Like that's a little more severe than just exercise. Like maybe there's something else going on to where it's causing a motor, something to fail, which might be some more, they might need further imaging. But the big trick is like the way to go to physical therapy right now, like in the clinic setting, is so this is why my private stuff works so well. So I tell people to come straight to me when something is going wrong, or like there's something going on, or you want to be, there's a little ache or pain you feel, to address it earlier, versus the typical route. The typical route is you have your pain, right? Something happens and then you get hurt, and then you make an appointment, all right? You're probably going to see your doctor in a month, maybe 2 months, like depending on what's going on. You'll get to your doctor. The pain might be worse now. The doctor is going to look at you, probably give you some pain medication, and then kind of tell you to either rest or stop doing that activity, which a lot of my, especially female patients, I have a lot of female patients, like their primary care or whoever they saw told them, you are a female, you should not lift. And I was just mind blown by that. So it was like,
I mean,
I was
I'm
like,
mind blown right now.
yeah. So it was like wild. I'm like, oh, like, okay, you shouldn't work out. You shouldn't lift weights at all. So I've had like, I would say like 10 private patients who told me all that almost exact same thing. So that's kind of the route. So you go there, you have to take time off of work, which is kind of money in your pocket, to go see the doctor. They're going to eventually send you to physical therapy, which is another probably a month, another 2 months. By that time, these kind of pains have become ingrained in your brain to where it's getting to this a little bit more chronic type pain, which now, even if you have healed, in the back of your mind, now we have to kind of work on healing the mind a bit, because the mind plays a huge role in pain. And I mean, that's kind of one of my specialties, is this chronic pain and discussing what goes on with the brain and kind of all the receptors and the things like that and how we perceive pain. But I usually discuss that with the patient when they come in, and we kind of chat for about an hour and a half about what's going on. I do my tests and measures. And that's kind of why I like having that time with those patients and spending all that time, because I can educate. And if I can educate you, maybe you can educate someone else. And then they educate someone else. And it's like this web that just keeps going. And it's like, I don't need to just stop exercising overall, like ever. So it's like, I need to keep moving. And our bodies are meant to move. So that's kind of the big thing. It's like, I want you to be able to, and it's not about moving and being really good now, it's being like lifelong. Like, I want you to be able to do this into your 50s and 60s and all that stuff.
Has this perspective always been there in physical therapy, and now it's just getting the attention, or is this something like, new science?
So there's also, so the thing is, there are therapists, and just like any profession, there are people that are good at their job, there are people that are bad at their job, and there's people that kind of go above and beyond at their job. So I try to go above and beyond, because a lot of therapists, yes, you learn some of this in school, but not to the degree you learn if you continue educating yourself throughout. So after grad school, there's a lot of education to be done. So like, graduating grad school gives you like the basics. Then you can kind of pick and choose and learn. So it's very complex afterwards. So I kind of dove into it because I really was intrigued by all this stuff. Mm-hmm. So yeah, it's more so learning afterwards and being like a lifelong learner, trying to really learn more and like, oh, like this is now what our profession thinks is best.
For the athletes and non-athletes, let's say 2 big injuries that I see. You're talking about lower back pain. Mm-hmm. And I'm also going to bring up the whole trap and neck pain.
The neck pain.
What are probably the most effective? Because I already know a lot of people that say, I just don't have the time. I can't go to the gym. I can't do exercise. I probably have 5-10 minutes. Yeah. What's the most basic exercise or something you can tell them right now? Hey, this is what you just need to do. Yeah. Right there.
So the tricky part is I would have to assess them to give them guided advice specific to their injuries. But in general, a lot of people, my big thing I see a lot of people complain of tightness. Like, my neck feels tight, my back feels tight, my shoulder feels tight. They complain about all this tightness, and then I go and I assess them, and I'm like, oh, your range of everything's fine. Like, once you're relaxed, things are fine. That tightness that people feel is more so a weakness that their body isn't able to handle the load that you're making them do. So for instance, like desk work, if you were trying to work on your posture and you thought it was a good idea to sit upright all day long in your chair without using a backrest, you're probably going to have some pain because you are overexerting those muscles beyond what they're capable of, versus doing a rehab program and all that stuff. So the big thing I would tell people is, when I would focus more so, like, yes, you need to stretch, but strengthening is almost more important. Right. So I would focus more on the resistive exercise portion. So using things like weights and bands and all of that stuff, and doing that stuff versus just sitting there and stretching and pulling on muscles. So yes, it might feel good to do the stretch, but in the end, in the long term, it might not get rid of that pain.
usually for like lower back is strengthening the core, right? Because people tend to give out, and which is why they start slouching. And
So core stability is a big component. A lot of it's called your posterior chain as well. So the glute work, the working on the glutes, because your glutes kind of insert on what we call your thoracolumbar fascia that kind of stabilizes your lower lumbar, and also implementing some of the lats. So your lats actually help stabilize your low back. So there's a huge kind of like band of muscles and a bunch of connective tissue that attaches at your low back that needs stability, and sitting on your butt all day isn't really going to work it. So I always see a lot of people like, okay, like I'm doing my exercises, I'm doing a few things, I go on walks, I'm like, yeah, but you're working in construction or something. It's like, it's very laborious. So
right.
And that might over time might take a toll on
You're
people.
breaking your body down. It's literally getting a workout every time.
Yeah.
So like the correct posture, having your ear aligned to your shoulder, or
So posture is a tricky one. So there essentially is no correct posture, because whatever's might work well for you might not work well for me. When I document at work, I'm leaning back in my chair, I'm slouched, I'm like this, typing, and I'm not like this because that doesn't work well for me. So everyone's a little different. Posture has this whole like, yes, there is a correct posture that some people say for the line of gravity. You want it to go straight through, but it's like some people don't need that. Like you can see younger high school kids and all that stuff. They're slouched in their chair all day long and they don't have any pain.
I'm happy to hear that, because at my work, where I am sitting in the cubicle, I do tend to slouch and work instead of doing this, because anytime I try to do this, it's like my shoulder's getting tired.
Yeah,
my
you'll be
back
fine.
is starting to get tired.
You'll be fine. So don't worry about posture too much. Like I wouldn't overemphasize it. Just be comfortable. And the same kind of thing goes for sleep. There's not really a correct way to sleep. Just if you're comfortable, then that's kind of where you want to be. If you're trying to force yourself to sleep on your back, that's not comfortable. Thinking that's going to keep your spine straight, probably not the best thing to do. So comfort is kind of where it is. And then what's crazy is the same thing goes for running shoes. Like I've done some research on that, and it's like, yeah, like people buy these crazy expensive running shoes, and it's like it doesn't really matter as long as they're comfortable for you.
Right.
So if they're comfortable for you and they feel good, it's going to translate over to even though you might have a little bit of a collapse in your arch, it's the comfort that we're going for. So it's and there's a lot of articles and stuff to read that go with that.
Thank you for pointing all that out, because I think that's very important, especially like now that advertisement is everywhere. Hey, buy these shoes. They're only $200, but they'll keep your feet right.
So no,
I've seen that. I'm glad you brought that up.
Definitely tricky. So there's a lot of different realms. So going back, backtracking to PT school. So like I know there's maybe some viewers that want to become PTs, and I get asked by people all the time, like, oh, I want to do that. That sounds really cool. Like, what do I need to do? So like I know I talked about.
I'm glad you're bringing this up, because that was going to be my next question. Like, what is the realistic take in terms of what is the most realistic advice? Because I don't want people. Because a lot of people, they just get blindsided by, hey, like, this is what I love, this is what I'm going to do. And then they get to it and it's like, this is harder than I thought.
Yeah.
I want you to be as realistic as you can in terms of, your not just your journey, but what do you see common?
Yeah. So you do have to enjoy it, obviously. Most people that go into PT do enjoy movement or do enjoy something. Whether they enjoy, it doesn't have to be athletic. They might enjoy, maybe they've worked in a nursing home and they enjoy caring for people like that in nursing homes and stuff like that. And there's PTs there. But some of the things I do see, I have seen a couple people go through PT school, have their doctorate and work and go back and switch and do something else because they weren't happy. They didn't really like it, it's rare. I know like maybe 2 people that have done that out of all the PTs I've ever met. So it is I love the profession because you can kind of make it your own. You can do whatever you want. Like if you have, we have 2 kids. So we have 2 boys, 2 young boys. And my wife, she's an occupational therapist. So it's similar yet different. But if you want the freedom when you're younger or when you have young kids, you can go and work at a hospital. And you can work a couple hours in the morning, take the kids where they need to go, and work a couple hours in the evening if you need to. You can work per diem, where you work as needed, and you can work part-time, all that stuff. And it's the demand for this field is pretty high. So when you get out of school, I would almost say you can get a job right away. And that's the nice thing about it. But as far as like in school, it is grueling. Like the first couple years, you're not used to this intense load of work, because there's been times where I remember it was either first, second, or third like little semester, where I remember like our finals week, which I call like hell week. I had 14 tests in 9 days.
Jeez.
So it was like, because you have a lecture exam and then you have a lab exam, and it could be the same class, but it's 2 separate exams. So I would have like anatomy test in written, and then I have a cadaver lab test where you have to figure out everything on the cadaver. Then I would have a different random like a physiology test, where, because in PT school you need to know how the physiology works, because you need to know like what's happening at a tissue level, how things are healing, because you are going to be dealing with post-operative. Like, people have surgeries. I need to know how that connective tissue is going to lay down after an operation, and you have to know all of that small molecular stuff.
Mm-hmm.
And so you end up having one of those. So it's brutal. So
I can only imagine, man, because I had nowhere near as difficult as you, but I made one mistake one semester that I was like, okay, I'm never going to do that again. I took, I think, microbio, I took OChem and physics all in one semester. And, those microbio and, and anatomy. Yep. So we had 3 labs and all that stuff. And I remember for the last, I think, 8 weeks, mm-hmm. I had at least one test a week. And then I thought that was stressful enough. Yeah. I can only imagine 9 days.
Yeah. So it's brutal. So yeah, it's a lot. Some of them I'm just going to go in here and whatever I know. Like, if I don't know it, I'm not even going to. Like, so that's it is brutal, but the nice thing about PT school versus undergrad is what you learn your first year, you almost relearn it again your second year, and your third year you relearn it. So it's 3 years of school, so about 2.5, I think, combined with the internships. You do have 3 internships. So mine I had 3 of them, and they were all local here. So I worked at I did inpatient at Clovis Community, I did outpatient at Clovis Community, and then I did, there's a place called San Joaquin Valley Rehab, which I did outpatient there as well. So it's nice because you have like a person that teaches you and all this stuff, and you kind of get the gist of how PT works in each setting. So you can kind of talk with your professor if you're leaning towards, I want to work in a hospital, and you can go to a hospital. If I want to work here, you can go work here. So there's a lot of avenues. But as far as like PT school, yes, it is grueling. But it eventually just goes, like, you eventually just become numb to it. You're just like, yeah. I'm just studying. Like, I'm here to study. Like, yes, we still partied like crazy. Like, we'd go out, like, hang out, drink, party, all that stuff. But it's like, you party hard, you work hard. So we would, like, study all that stuff late at night, reading all sorts of different things. And the really nice thing about PT school is that everyone there is wanting to learn. So you can talk to people in your class and have these groups of people, and you can kind of study with them, ask them questions. I relied on some of my other people in my cohort and stuff to really help me, because I'm like maybe they understood what the professor just taught and I might have been lost, and I'm like, hey, like, did you get what they were saying? And they would explain it to me in their way, and I'm like, oh shit, like, now I get it. Like, that's like, and so it's like nice to have that stability, and it's such a small, tight-knit group, like 30, 40, 50 people, depending on your school. It's like everyone knows everyone, and you get pretty physical with them. Like, you're touching and palpating and pushing on almost every body part on each person. So you get pretty intimate with all these people. So it's pretty cool. But once you graduate, so again, you do your PT school, the big thing people complain about, which I also complain about, is the cost of graduate school in America. I don't know how to change it, but it's one of those things where, yes, it is expensive. So you go undergrad. My undergrad I didn't have to worry about with sports and stuff, so I didn't have to worry about the cost of that. But in grad school, like when I graduated, I want to say my debt was like, my student loan debt was like $90,000, which is like a pretty nice Tesla. Yeah. So it's pretty tough, because I'm like, oh, like, you go out of school, and And now it's gone even higher because I've been out of school for many years, and that was high for then. And I went to a private school, so it was even higher. But like the prices are, I feel like, are only going to go up until something happens. I don't know what's going to happen, but the price of school is only going to go up. But it's more so investing in your future, because we are a profession where in order to do this profession, you have to have a degree.
Right.
Like you can't just go and be a PT and just do it on your own versus like an entrepreneur. Yeah, you can just do it on your own. You don't need college. In this profession, you have to.
It's kind of weird because I feel like this is just like a political opinion of mine. Not everyone has to agree on it, but I feel like any career where you have to serve the public, like PT, like, a doctor or a cop or anything like that, where you have to have this knowledge that not everyone can do, right? I think there should be some type of loan assistance programs to where maybe we'll cut it in half. Not necessarily make it all free, but make some leeway, because I think that will bring more attention. You're saying there's it's a high demanding job, but at the same time, are there even that many graduates going on? Yeah. Why don't you do something that's going to make people say, okay, you know what? Maybe that is the route I want to go, because I'm confident that I'll be making it. This is something I want. And they don't have to be scared away just because of something they can't afford, right?
Yeah.
Because you see some of the most talented people on the street, and you're thinking with the knowledge that they're able to pick up just like this, imagine if they actually were certified to do something bigger, how much of a great change.
I know a lot of personal trainers. I'm like, damn, you'd make a pretty good PT.
Yeah.
I was like, you should probably have gone this route, but they're like, yeah, it's expensive. I'm like, that's the tricky part. It is expensive. Yeah. But I know personal trainers, and being a personal trainer is a grind. Mm-hmm. Like you are grinding. You're a salesman. You're a salesman, and you have to sell your services and this and that. So I'm like, versus PT, it's almost given to you. Where you work, it is given to you. So it's a different, my big thing is it's quality of life. Like, do you want to hustle and grind for a long time, or do you want the comfort of knowing you have this income coming in? So again, PT school is expensive. Maybe blah, 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 depending on the schools. Some of them are ridiculous. So Fresno State right now, I want to say, because it's the cheapest school. It's the cheapest state school, PT school, I want to say is around 60 something.
Okay.
Some of the private schools, I want to say my school has gone up to about 130. I just heard that USC is at 190. Yeah. So it's maybe 180. So it's pretty insane. But the tricky part is yes, that's terrible, but when you come out of school, it was different when I came out of school, but I want to stay starting salaries right now for a PT in outpatient ortho. So outpatient settings where a lot of PTs want to be. So the tricky part is with PT is, and it's a lot with a lot of professions, is where you want to be is usually not reimbursed the best. Where you don't want to be is usually reimbursed higher, because not a lot of people want to do that job. Outpatient ortho, a lot of people want to do it. You probably start coming out of high school out of grad school probably around $80K, so 40 something bucks an hour, which is not bad, and that'll kind of go up. And I want to say it kind of caps. There's a cap around 130, something around there, and that's the longer you do it. But you can also start a business. If you want to be an entrepreneur and do stuff, you can open a PT practice. Yes, it's a headache and it's a lot of work, but if you want to do it, do it. I know people that have done it. They're making that $100K without having to work. So but they're doing other work. They're doing different ththings. So it's a whole nother realm. If you do PT school, I want to do the business route, you can do that. I know a PT. He's a uncle of mine. I've known him since I was 5 years old. He's a PT. He's now a VP of a hospital. Mm-hmm. So it's very you can go up the chain, switch to things one of the
flexible. Basically.
One of the PTs. She's now the CEO of a hospital, which is once you kind of build it, it just takes time and kind of connections and showing who you can what you can do. But as far as the quality of the job, I think it's very, very good quality for, yes, you have to sacrifice your time in the beginning. Yes, you have to. So essentially the total schooling is about 7 years. So 4 years for your undergrad, and then depending if you actually get all your classes done and you get all that stuff, that little gap can be as short as 7 years, or it can be longer depending on how long it takes you, which is not bad considering compared to a medical field where it's like 8 years, so 4 and 4 plus 2 years of residency and all that stuff. So it's different. But honestly, it's kind of find what you love. Like if you love the medical field and doing all that stuff, like the actual physician type stuff, do it, go for it. But if you enjoy movement and things like non-medical stuff. So there was this quote, I can't recall it exactly, but it was a quote by, I want to say Albert Einstein said it. But the quote was, I should look it up. It's a really good quote because it kind of, but it said something along the lines like, the doctor of the future will no longer need to prescribe medications. So it's like they'll do other things to make their patients better.
Right.
And it's huge because it's like that's kind of where we're going. Like there's a lot of, they call it pseudoscience, but there's a lot of things going on where it's like things like all this other stuff that isn't researched much, like breathing and how important breathing is, and meditation, all this kind of stuff, which you do learn in PT school. You learn a bit of it, but you can kind of continue after you're done.
Right. And I think that's the type of medication that actually has been around the longest, right? Yeah. I mean, you look at yoga, you look at all these different ways people learn these techniques, whether it's breathing, whether it's being able to be more agile, you know. Mm-hmm. They call it like holistic science type of thing, right?
Holistic is kind of a weird word for it.
Okay.
I don't really like the word holistic because it just implies something like not medical.
I got you.
Where it's like,
we won't call it that.
So I'm like, holistic, yeah. I just call it like Eastern medicine, all this stuff. I'm like, it's medicine. It's things to do to make you better. It's just not researched as much until recently. So recently now they're starting to do a lot more research on crazy things like grounding. Like, I don't know if you've heard of grounding. Grounding a lot is essentially, in simple terms, going outside and making your skin touch the ground. So grounding is huge. It's a huge up and coming thing that a lot of people are doing. Same with like all the diaphragmatic breathing, a lot of the deep breathing, a lot of the things that combine kind of like sunlight and how to properly, like I was educating a patient earlier on sleep. Like your sleep is very important to you as a person because that is when you recover.
Yeah.
Essentially all day you are breaking down.
The rest and digest system.
Yeah. So essentially all day your body is breaking down. Whatever you're doing, it's breaking down. When you go to bed is when you recover. Things rest. If you're not getting good quality of sleep, you're not really going to recover as optimally as other people. And laying out the room is going to be very important. So I was telling him, I read other books all the time too. There's a really good book. It's called Brainwash. All right. You should probably listen to it or read it. It's by Dr. Perlmutter. So it's a pretty crazy book. He goes into a lot of other things, but it's like there's been research done now where they're showing that there's receptors on your skin and on the eyelids of your skin that pick up light, that tell your body like this room is not dark enough and I'm not going to get the same quality as I would if in a dark room. So and this is like other things that you can do to help your patient the more you learn. So
right.
Yeah, so the more like I could, like if I had a patient come to me with all these injuries and they're just not recovering, like I have these tools that I've learned to teach them and help them versus like if you didn't continue trying to learn kind of lifelong. So that's kind of what makes a really good therapist. Like you want, and same with the doctor. Like you want your doctor to be doing the most recent and relevant tests and measures and the most recent surgery. You don't want some archaic surgery being done on you where it's like, oh, this is the new way we do it. Like this is minimally invasive, all this stuff. So you want kind of research-based stuff.
Right, and that goes back to your point. It really comes down to who you come across as your physician, or that, because some people I feel like, and I've been on the opposite end of both. You know, you have some people that are just so they're kind of like factory made, right? They're preaching what they learned and just what they learned. And then you have people like yourself where you're educating yourself further, you're you're actually paying attention to your experience, and then you're relaying that information. Hey, this is something I learned, and this is how I can apply it.
Yeah.
And that's really good, man. And I'm glad you were able to share everything.
Yeah.
And
no, it's and I mean, honestly, I could talk for hours, and it's like it's tough. I'm like, like I want to say everything, but there's too much to say. And the biggest thing is like, as far as physical therapy goes, like in regards to happiness of the job, I'm happy with the job.
That is what you can
and
ask.
I've been asked, we were at a church thing, and someone asked, someone was like, hey, like, if you had all the money in the world, what would you do? And I was like, I'd probably still do physical therapy, but I just wouldn't charge them as much.
Right.
It's like I couldn't see myself doing anything else. Like, I'm like, it'd be cool to learn the other things, but as far as the doing, I couldn't see myself doing anything else.
I'm glad you went that route, and because we are lucky to have you. I'm lucky to have you as my physical therapist.
Try to help all the local community.
That is awesome. Thank you for coming by, and for all the things you want to discuss in the future, this doesn't have to be the one time you come down here. Awesome. Whenever you have time, man. Perfect. We can continue expanding on everything.
Perfect.
And thank you for coming by, brother. And
thank you, Manny.
See you all next week.
See you guys.